Come in. Morning, Miss Huntley. My name's Anna Huntley. I'm going to be your nurse, or your student nurse from University of Memphis. How are you doing this morning?
Fine.
Okay. Can I see your armband, please? Can you confirm your full name and your date of birth for me?
Brandy Huntley, February 8th, 1976.
Okay, wonderful. So today we're going to do a cardiovascular and abdominal checkup on you and everything. We're going to make sure that your pulses are nice and strong and equal on both sides. We're going to listen to the 4 valves of your heart to make sure that those don't have any extra sounds or murmurs in them and everything. And then we're going to inspect and do some percussion and palpation on your abdomen, okay?
Okay.
All right, so we're going to start off. I'm going to inspect your anterior chest and everything. Now, for the sake of the video, we're not going to have her raise her shirt or anything, but if it was a real patient, we would have them lower their gown to their waists in order to allow for proper inspection. All right, so I'm going to inspect that chest. Okay, I don't see any pulsations or extra heaves or lifts that would be abnormal. So now we're going to start off and we're going to auscultate the 4 valves in your heart and everything. So we're going to start off in the second right intercostal space. I just need you to breathe normally for me. So I check your aortic valve. Do the same thing with my bell. I'm going to go over to your second left intercostal space for your pulmonic valve. My bell. Okay, and I'm going to come down your left lower sternal border for your tricuspid valve. And I'm going to go over to your 5th left intercostal space for your mitral valve. Same thing with the bell. Okay. So the S1 and S2 were crisp and clear. I didn't hear any extra heart noises of S3 or S4, so you didn't have any murmurs or anything, so that's wonderful. So now we're going to do a similar thing. We're going to listen to your apical heart rate, and I'm going to get a nice rhythm on that, okay? So I just need you to breathe normally for me, and we're going to listen to this for a full minute, all right? Got 87 BPM on your apical rate of your heart, and we have a regular rhythm on that, so that's wonderful. So now we're going to compare that with your pulse point. So if I could see your wrists, please. I'm going to check your radial pulses. And we have a pulse rate of 87 BPM bilaterally with a regular rhythm and a 2+ force in your radial pulse, so that matches your apical pulse. So now we're going to come down here and I'm going to do your dorsalis pedis pulse. I'm going to listen to that or feel that for about a minute too. And pulse rate on those is 87 BPM bilaterally also, which matches both of your other pulses, and we have a regular rhythm and a 2+ force on those too. So now we're going to go into your posterior tibial, so if you could lay down and flex your knees for me. Okay. I'm going to listen to those for a minute too. Alright, we have another pulse rate of 87 BPM, regular rhythm, 2+ force, so that all matches. And so now we're going to check your femoral pulse and everything, so you're going to feel my hands down here and everything, okay? So just relax for me. We're going to listen, or feel right here for about a minute too, okay? Okay, and so while I do my hand hygiene, that was 87 BPM with 2+ force and regular rhythm. So now we're going to start on your abdominal inspection and everything. And again, if this was an actual patient, they would not have their shirt on and everything, but to maintain modesty and privacy for this video, we're just going to simulate that the shirt is off. So what we're going to do is I'm going to shine this light across your abdomen where I can get good view of what it looks like. Okay. On my my inspection, we have rounded contour on the abdomen, no masses seen, no lesions, no surgical scars, no striae noted. And so now we're going to move into our auscultation of your bowel sounds, okay? I just need you to just keep laying there relaxed for me. Alright, so we're going to auscultate for your bowel sounds. Okay. We have normal active vowel sounds in all 4 quadrants. So now we're going to do some percussion of the quadrants of your abdomen, okay? You have good tympany that resonates over the 4 quadrants as expected, so that's a normal value. So now, did you empty your bladder before we started the examination? Because we're going to do some palpation now.
Yes.
Okay. So we're going to start off with some light palpation. If you feel any tenderness or anything, just let me know and I'll stop, okay? Okay, do you feel any tenderness with that?
No.
Okay, so now we're going to move into the deep palpation. Okay, any tenderness there?
No.
Okay, so abdomen was soft to touch, there was no organ omegaly, I didn't feel any masses or anything in there, and there didn't appear to be any enlargement of organs. So, no tenderness noted between light and deep palpation, and as I stated earlier, all of the pulses matched at 87 BPM bilaterally, and then also matched with the apical heart and everything. Okay, so I think that's about it. We had good tympany across your abdomen and everything. I didn't note any lesions or masses, so I think you should be good. Your doctor will be here in a few minutes, okay?
Okay. Thank you.
You're welcome.